and also their ability to be able to create a perception as healthcare providers. And of course, these particular organizations, when we talk about healthcare organizations, we can talk about hospitals, clinics, pharmaceutical companies, and of course other types of healthcare organizations. So reputation management is all about how we influence and monitor, control perceptions. Perception is simply what people think about us as an organization. Yeah. If you ask them about their opinions, is it a positive opinion or it's a negative opinion? Yeah. So this will of course be influenced by a number of things. Maybe how you are conducting yourself within the society, your contribution towards the society, what is the level of the services that you are offering there? Is it something that is making them happy? Then to them, they will perceive you as a good organization within their community, or that is serving them very well. Now, the reason why we need to do reputation management, or why it is important in healthcare, is to be able to create a positive or to create trust among patients. We seek to build trust among the patients that we are serving, and of course, this is going now to lead to better healthcare outcomes. So patients need to have a trust that when they come to you for whatever service, that you're going to meet their needs. And also, once we have a strong reputation, we will also be able to attract patients. We could also be receiving new patients. And this particular experience that they are going to have as patients is going to determine whether they stay or they leave. So when you have a positive or a good reputation, there's a likelihood that many would want to stay so that they could be able to enjoy your services. That is what we would call in business language customer loyalty. Yeah, so we could also call it here patient loyalty. They are able to trust you. They are able to trust the services that you are offering to them. And finally, or last but not least, we could also say reputation management is going to impact on the relationship, on how the organization is going to be relating with the community. And also, once this happens, then the organization could also invite financial support and partnerships, or what we call collaborations. So that's very, very important. So what is going to happen also when we have a good reputation, we could also be very keen in terms of ensuring that employees enjoy or feel safe in our hands as organizations or healthcare organizations. So how do we go ahead to create this positive image? That's what we will be discussing. Of course, there are other importances that you could be able to think about on how reputation management helps or assist the healthcare sector or healthcare organizations, besides what we have been able to mention. We could also talk about maybe the healthcare organizations having what we call competitive advantage. They have an upper hand in the services that they are offering. Clients are looking at them as the best option available to be able to provide a particular health service. Now, we have something we call intangible asset. Previously, reputation management was perceived to be intangible because it is something that cannot be seen. So this perspective has now been able to change. We could also now say that it's reputation management. It's not only an intangible asset, but it's an asset that is also able to take care of risks and responsibilities. And also we are keen to note that when the reputation is damaged, or the organization reputation is damaged due to various crises, scandals, we were mentioning this in our previous lesson, and any mistake that is going to happen, then that puts the organization in a very difficult situation. And it could be contributing to things like loss of patients. It could be contributing to patients moving to other facilities because we have not been able to take care of our reputation. So it is something very, very important that we need to always ensure that we are on the right side of matters reputation in terms of receiving positive relations, positive comments about the organization. So that's very, very important. So for us now to be able to get to that point, then we are now able to build a very strong brand. And also for us to get there, we also need to demonstrate expertise in what we do. We need to show that we are experts in whatever services that we are offering. We need also to be transparent in all our operations. We could also be able to engage in community engagement activities, what we call corporate social responsibility activities, and also ensure great customer service for the clients and customers to be able to enjoy our services and enjoy the work that we are doing as an healthcare organization. Now, sometimes we will receive negative reviews, negative comments. So what are we supposed to do as an healthcare organization? We are saying key point number one is we need to address these negative reviews with a lot of professionalism and empathy. So what you would be advised to do, the aspect of professionalism, first you need to read and understand the comment that somebody has been able to put online. We should not rush maybe to give responses before we have done research and understood the context or what contributed to this customer coming to our social media pages to comment something negative in relation to our services. Also, when we are dealing with negative online reviews, we could also, if it is a mistake on our end, we need to apologize where necessary. We need to provide solutions where necessary. It could be something that a solution can be provided by the healthcare organization. And also what I've seen commonly organizations doing, especially for negative online reviews, they will personalize the response. It is also a way of sharing or showing that you care. Personalizing response means if you go there and comment negatively, when the organization comes there, they tag your name or they mention your name to show that it is you they are addressing based on that negative review that you have put across. Yeah, so when we do not have negative review, then we have positive reviews. And for positive reviews in our dot number 2 or point number 2, we could encourage those people that have positively enjoyed our service to be able to leave positive comments. So they share their positive experiences. Of course, you know what is going to happen because of positive comments. It is also a marketing way, a way of marketing the organization. So encourage clients to leave these particular comments. We could be having issues of complaints. So efficiently, you need to handle these complaints that are going to resolve issues and prevent escalation. Escalation is where these complaints will become so big. Maybe they would be magnified by the media. So before we get to that point where a matter that could be resolved within the organization now cannot be resolved, now it means it has escalated and we need to know how to go about it. We talked about public relations and the need to safeguard the organization. And also from the complaints, it could also be a platform for us to be able to learn and improve our processes and services. That's keen to be able to note. Now, we have various crises and competition that healthcare organizations are going to face. Yeah, so during this crisis, then we need to come up with a management plan that is going to assist us to respond to unforeseen events. Unforeseen events are several risks that some of them, as healthcare organizations, you may not have control over them. So, as we are also handling crises, then the element of transparency and open communication is very, very key. And all organizations need to ensure that they are keen in terms of open communication. Now, for competitors, how are we supposed to deal with our competitors? We need first to monitor their activities and online presence. Remember, nowadays the success of an organization would be determined by something that maybe we could call small, like your online presence, your provision of information, timely provision of information, and that you are ignoring is what maybe our competitor is going to take advantage of. So that's why we are emphasizing on the need to monitor our competitors. And then also we can differentiate the healthcare organizations by highlighting strengths and unique offerings. I'm sure in other lessons or modules you could have heard about SWOT analysis. So you need to capitalize because you have competitors who are doing similar businesses maybe around you. You need to capitalize on making your strengths known to every person. You could be having a unique treatment machine that your competitor does not have. So you create awareness about it so that now you will stand a chance of getting all those patients and customers that did not know that that particular machine existed within that facility. Now, we have a few strategies that we could be able to adopt in order to be able to ensure reputation management is taken care of. For example, around online reputation management, we need to ensure that we are physically present within these platforms, social media platforms. We can review sites. We can always put out information through social media. This information is meant to engage patients and also address their feedback. And what also organizations are doing currently is also they are creating online content to showcase their expertise. For example, when you go to Facebook, you're going to find a page that they call Cleverland Clinic. When you go to that clinic, even today, when you go to that page, even today, you realize that they have made some comments. They have put out an article on the benefits of mushroom coffee. Previously, they had put an article on ways of effectively managing stress. So these are things that any other organization could be able to do to create awareness, informative content. People are out here. They would be suffering from various diseases, but they do not have information, and some even do not know how they can get that information. So these platforms should be able to work to benefit us as healthcare organizations. And in terms of social media, we have quite a number of them. It depends on what the organization intends to use. But of course, you should also be guided by the numbers. course, platforms like Facebook have been around for many years, so there are many people that are using that platform. Maybe it is one that we could consider. People are also moving, have also been around Instagram, WhatsApp, and so many other places. Now we have X, which was previously Twitter, and I'm sure we have so many other platforms that we could be able to utilize so that we can manage our online reputation. So that, of course, is meant to propel our organization to the next level. It's meant to put information out there that we are progressing, we are still active. A friend of mine was telling me the regular you put this information out, the more people are now getting to know that. So this organization exists. But when you keep quiet for three weeks, 3 months, you have not commented on those social media pages, people will not remember that there is such an existing page. But those organizations that know the importance of online reputation management, every day they will have something to give a comment about in relation to the work that they are doing. Now, other strategies for reputation management, we have what we call offline reputation management. So these ones, we focus on quality improvement initiatives to enhance patients' experience and clinical outcomes. And we do this by building very strong relationships with the community. Yeah? So we can do what we call community outreach. That is related to what I just mentioned on corporate social responsibility. We can undertake activities within communities. We can seek partnership with organizations that we feel that we are strategically positioned to assist each other, or they are strategically positioned to assist a particular health organization or our health organization. Those partnerships are very, very important. So if we are not online, we could move to the ground. That's what offline management is emphasizing, and interact with the community on a one-on-one basis. And then also, like I said about online, we need the aspect of consistency and monitoring. We need to be consistent in terms of the brand image, in terms of the messaging across all communication channels. So consistency, we do it online, we do it offline. We ensure we receive feedback. Whatever is negative, we have just seen that we can be able to resolve that issue and ensure that reputation management has been well taken care of. Now, we have something we call reputation capital. This simply means the value that an organization is going to derive from its reputation in the eyes of its stakeholders. So if you are doing everything right in terms of reputation, then you gain what we call reputation capital. And through this, you can be able to build trust, you can be able to build loyalty, you can be able to build credibility among customers, among employees. Customers in this context would also be patients, among investors, among regulators. We could talk about government being one of the regulators, and also the public. So the importance of reputation capital then means that it cannot be ignored. Some of the benefits that organizations are going to gain because of reputation capital, besides what we have just listed in terms of loyalty, trust, the organization is also going to be set apart. That's what we call competitive advantage. You will have an upper hand in those particular services that you are offering, because along the way you have built your reputation, and now you have what we call reputation capital. And in terms of the employees that we have just mentioned here, you will also attract those that we would deem as top talent, the best in the market in terms of the levels of education, in terms of the levels of services they offer as individuals. Because of reputation capital, everybody wants to be associated with you. And also through that, we could also get patient referrals. So those patients that have enjoyed your services, it could be very easy for them to refer people to come into that healthcare organization. And then we have also previously mentioned about partnerships. So it will be easier to get partnerships and collaboration. And of course, it would be very easy for you to gain or provide improved healthcare services. We have also something we refer to as a corporate identity. And we are saying this is an organization's distinctive character or personality that is going to set it apart from others. We have just talked about competitive advantage, where you are set apart. You are placed in a position better than the rest. So corporate identity is a combination of what values do you hold as a healthcare organization, what is your vision, what is your mission, what is the culture of that organization, what is the history. Of course, if the history of this particular organization is positive, whether the management changes, whether the leadership changes, everybody who comes on board will seek to ensure that that history is maintained. So corporate identity is very, very important. We are saying this particular identity will also shape how an organization perceives itself. If you have a very nice history in terms of your services, anybody who is around means they will feel it. That's why we are saying the organization perceives itself and how it will also want to be perceived by others. Yeah, so identity is key when we are around healthcare issues. So healthcare providers, it's very important for them to now tell the community, tell the citizenry about the purpose, about their goals, and they also define the standards of excellence. They could also have what we call a charter that is going to define the services that you offer, what is the duration of each service, what is the cost of each service. By doing that, you will also benefit. Corporate identity is going to take you to a place where you now enjoy brand recognition, you are consistent, and also what we have just mentioned in terms of patient loyalty. They are able to get repeat services from you because of the good work that you have been doing. Now, it is very, very important for us also to measure reputation. We are bound to use a number of tools. We can be able to check what is our reputation as an organization. So we could go ahead and use methods like surveys. We could conduct surveys. We could conduct ratings. We could conduct rankings. We could conduct reviews, media analysis, social media monitoring, stakeholder feedback. There are quite a number of things that we need to do. Some of these things we could also engage outsiders, people that are not part of the organization, because of something mentioned in the second sentence in relation to biasness. So we could also, when we talk about social media monitoring, once we put out any issue, just by reading the comments that are there, we would tell that whether the public are with us or it is an opportunity for them to lynch us. Yeah, so we need to be very keen about that. So when we are doing reputation measurement, then we need to have a careful design and execution of a comprehensive and a customized approach. Yeah, so it is you as a person who is maybe in charge of the organization, you are part and parcel of the organization. If somebody would suggest to you that we need to measure our reputation, then you could easily give them any of these methods for them to use based on the results that they intend to get. So most of them are quite around our everyday practices. Stakeholders, I did say there are people that are interested in the organization. So we could listen feedback from them. It could be investors, it could be patients, it could be the government, and so on and so forth. So it is possible to be able to measure reputation. That is the key emphasis in this particular slide. Now, what are some of the factors that are going to influence reputation? Stakeholder expectations. Yeah, so if the stakeholders are highly expectant of us as an organization, then we would look at aspects that are going now to push us to the next level in terms of having a very good image. And then other factors that are going to influence reputation are around competitor actions. What are our competitors doing? Being in the world of competition in business, in the health sector, it is very, very important to be abreast with what competitors are doing. Yeah, you will hear maybe your competitor has brought a very unique machine into the country, and a machine that is quite expensive. So your reaction will now determine whether you continue to stay to offer those services, or people are going to have to benefit from your competitor. The other one is the levels of media coverage. Like we were saying yesterday, anything that you do positive, you need to put it out there in print media, in television, in radio, so that people can know that this and this has happened. And I was giving an example of when a healthcare facility in the name of an hospital does the first of its kind of a surgery. What is likely to happen? They need to put it out there so that people can know that this surgery happened, and it happened in this health center, it happened in this big hospital level 5, and whatever other kinds of facilities. So media coverage is key, and that's where the aspect of public relations comes in. Anytime you're also launching something new, you need to invite the press to come and cover the event. And once they do that, that would be part of the news items for that particular day. So media coverage is really key in terms of influencing reputation of an organization, and also an organization's actions and communications in terms of the services that you are offering, in terms of the actions you are doing to the community, your levels and how you communicate issues, positive and negative, will also be key in terms of ensuring that your reputation is deemed to be good. We have also what we call comprehensive reputation management. We are saying this is something that is very essential, and it is needed in every organization. And when you are talking about comprehensive reputation management, there is the need for us to always be consistent and credibly perform all our activities. And when you are doing it, we also need to be guided by our identity and also be guided by our values. So this is something that we cannot be able to ignore. Comprehensive reputation management. It focuses on our levels of consistency and how credible are we in offering our services. Yeah, so it is very, very important to also understand that when we are looking for consistency and credibility, everybody within the organization has to be involved, from the top to those that are very below in the organization structure. Yeah, and also for us to gain or get comprehensive reputation management, we need also to involve all the relevant stakeholders, both internal and external. And by doing this, it's also a way of building trust and mutual understanding. Yeah, so the key reason also where we are doing comprehensive reputation management is we want always to maintain a positive perception of the work that we are doing. We need to have people comment positively about our services, understand our services, and that they can be able to refer other people to come and receive similar services. So for us to ensure also comprehensive reputation management, we need to ensure that we have high quality patient care. We could also have it as a priority, matters to do with patient satisfaction. We could also have open and transparent communication, and also have a strong and a consistent visual identity. And we can all do all these also through community outreaches and engagements. So this is a slide also that is going ahead to clarify on matters comprehensive reputation. And we are saying it's not just all about what the organization does and says. It is also very important to the organization to know reputation is also about how it relates with its stakeholders or her stakeholders. So what kind of a relationship do you have with your patients? And this relationship is built along by things like trust, things like respect, things like transparency. How fast are you in terms of responsiveness, collaboration, and the need for all of you, the organization and the community and the patients, to mutually benefit. The patients are going to benefit from your very good services, and you, as the patient, would be able to send that information out, and in return, we would have more patients coming into the healthcare organizations to be able to provide, to receive these kind of services that they have heard about. Now, where we have a bad relationship, then it is characterized by distrust, it is characterized by disrespect, it is characterized by secrecy, it is characterized by conflict, and those are things that we want to avoid going in that particular direction. Then we will discuss on what we refer to as the 10 precepts of reputation management, or simply what do we need to do so that we can ensure our reputation is well managed. The first thing is to be able to know your identity. So very importantly, you need to tell everybody what does your organization stand for. And when you are telling them about what you stand for, they are able to know that there are the do's and don'ts in this particular organization. That we do not condone, for example, any kind of corruption. We were mentioning yesterday around things to do with bribery for you to get a certain service. So is that the identity that you would want your clients to have on you? That for me to get a service from facility X, besides me having money for medication, I need a small tip where I can give so and so that they can get me to a particular office. That is not the direction that we want to take. So once you know your identity, define it, explain it to everyone so that they can be able to understand. And also know your stakeholders. Who are your key stakeholders? In an healthcare organization, of course, key stakeholders would be the patients, it could be donors or people that you are collaborating with. So you need to know them. The reason why we are emphasizing on you knowing them is that every day you need them in your activities. No man is an island. So you cannot say now you are a very strong healthcare organization and therefore you do not need any other person. Yeah, so get to know their needs. If it is patients, what are their expectations when they come to that facility? What are their perceptions? Perceptions, we have just said it's how people think about you as an organization. Is it something positive or it is something negative? And if it is negative, you need also to strive to slowly by slowly clear that out of their minds by offering them better services. Uh, and the third thing that you need to do, you need to know your environment, analyze the external factors and the trends that affect your reputation and your stakeholder relationship. When you talk about external factors, are those factors that you may not have control over them. They could be things to do with political factors, economic factors. Maybe we have, for example, under economic factors, increase in taxation of particular drugs that are meant to benefit the community. So what are you likely to do? You are likely also to be forced to increase your prices from whatever price that you sell. Yeah, so what is it that going to do to your reputation? Is it going to damage it, or there is a way that you can approach it that customers do not complain about it? Yeah, so uh, we could also have social cultural factors. These are factors within people, communities. Um, they need they need to you need to know their way of life, understand them so that you can be able to serve them well. Uh, Under social cultural factors, we could also have things to do with religion. You need to understand them in that particular perspective. And you also need to understand them in terms of their beliefs, their traditions, and how it affects your reputation. And also, finally, on the fourth one, you need to know your strengths and weaknesses. We have just mentioned this a while ago. Of course, you need now to build on your strengths, capitalize on them, so that customers can be able to benefit from the good work that you are doing. The fifth one, you need to know your opportunities and threats. These particular strategies here, they are just revolving around what I mentioned about SWOT analysis. So know your opponents, uh, their opportunities and threats. So identify potential scenarios and events that can enhance or damage your reputation. So when you are in the market, the healthcare industry, the, it means also you need to be aware of risks that your organization faces. That some of these risks would damage your reputation. So also know your goals and strategies. You need to be very clear, set realistic goals um, for your reputation. That will be very, very important. And also you need to know your actions and communications, implement your plans with consistency. Everything that you have planned to do, make sure you do it to the best of your knowledge, so that you can be able to succeed as an healthcare organization. The eighth one, know your feedback and evaluation. We talked about the importance of you giving feedback. And we also mentioned about the issue of monitoring your reputation. So any negative information or feedback that you receive, you need try and respond where possible. Also apologize for the sake of moving the organization forward. And then also you need to know your areas of improvement and innovation. What are the areas that you can now become better? You have received feedback very many times. So what are the areas that you can become better? So that's very, very important to be able to know.
Police, please, can you put off your mice?
Okay. So that one is key for every person. Identify the areas that you can improve. And we have said those areas can only have one way of identifying them is through the feedback that you receive. What areas have challenged you, and what areas do you feel that if you do this extra thing or item, you are going to be able to move to a way new level. Yeah, so any areas of improvement, make sure you do something on them. And finally is you need to have continuous and collaborative learning. In every organization, even us at individual levels, learning never stops. So we could have continuous trainings around improving our skills. Remember, once we benefit, like the knowledge we are benefiting from this particular session, tomorrow we will better serve our customers. Tomorrow we will better offer our services because we have gained knowledge of things that we did not know, and they are able to assist us to move forward. Now we have a very important concept where we call it corporate communication, and we are saying this is just a process of creating and maintaining a favorable image. And when we are doing it, the reputation of the organization improves. Yeah. So when we are doing corporate communication, when we talk about corporate, we also mean organizational communication. And that's why we are saying it's not all about sending messages. And it's not all about informing people. And it's not all about just doing just some normal promotions. Yeah. It's about us taking the lead in terms of communication. Yeah. It's a strategy that we can adopt, that we can become better in compared to our competitors. And that, of course, is going now to put us to a way new level, because we have not just taken it as any other form of communication. We have taken it, we have adopted it as a strategy, and we have led the rest in terms of communication, corporate communication. And of course, when we do this now, we are going to benefit as organizations through proper brand image enhancement. We could enhance our brand image. Remember, we have taken the lead in matters corporate communication. So our brand, we are pushing our brand to a way new level. We have also improved employee morale, and because our information is out there and people know about our information, we are able to articulate visions of the organization in a very clear manner, and also we are able to maintain positive relations with various stakeholders. And that's why we said it's all about creating and maintaining a favorable image and reputation of an organization in the mind of its stakeholders. So once we do that, we are also going to take the lead in terms of expansion and growth, because people perceive us to be doing things right, and our information is out there. As leaders in corporate communication, our information is out there, and we could likely reach very many people. And this will now take us to a different level as an organization. We have a very, very important theory where we call it the systems theory. This theory is also studied across other areas, also around management. And the system theory, just like the name system would mean, it looks at every organization as a system, and we have interrelationships and interdependent elements. And once we have these elements, this level of interdependence, interrelated and interdependence means we could be having few things that they have to work together for communication or reputation to remain top notch. Yeah, so the systems theory simply will suggest that for any reputation of an organization, it has to be influenced by inputs. When we talk about inputs, they are the things that we are putting into the organization in order to be able to build the reputation. For example, what kind of employees are we bringing on board? That is an input. When if we want to excel in matters reputation management, we also need to have people that understand that concept, people that have knowledge around public relations. So that's part of our inputs. It could also be if we are giving drugs, what kind of drugs, where are we sourcing them from? Because all those are inputs. If we mess on the inputs, then most definitely the outputs are also going to go wrong. What kind of processes are we running within the organization? Are we keen in terms of feedback and outcomes of the entire system? So the key suggestion of this particular theory is that reputation is able to be improved by enhancing the system's coherence. We need to have alignment, balance, and resilience. So in terms of inputs, we need to have them balanced. Let's not have in terms of inputs. We are doing very well in terms of getting the right personnel who are qualified. But when it comes to the drugs, for example, we want to compromise. Maybe because of what we were saying, corruption. People want to capitalize on eating some money that they are not supposed to eat. So we need to have coherence, we need to have alignment, we need to have balance, and we need to be resilient. For this system to be able to work, we need to put our efforts so that we can be able to realize that what we are calling a system is working. And when a system is working, everything within the system is moving towards realizing the final goal or objective. So the concept of the systems theory will never change, even if you are looking at it from a different perspective. It is simply emphasizing that there must be some interrelationship and interdependence within an organization for reputation to be able to work, or for us to have a very good reputation. All systems must be working and working properly. Now, we have what we call successful reputation management. We have examples of Mayo Clinic, Cleveland Clinic. I just gave an example of that kind of a clinic, what is called Cleveland. When we talk about Mayo Clinic, we are simply saying this is a healthcare provider that is built and maintained a global reputation for excellence. So anytime you need information in matters health, you are most likely going to meet and interact with articles on Mayo Clinic, information from Mayo Clinic. So what has taken them to that level that everybody knows about them? Most likely, if we open an article now, maybe anything related to health, you are going to find a document from Mayo Clinic. So for them to reach there, then like you have just said at the system theory slide, they must have had all activities around them interrelated, and all of them are working. So they have been able to stand out in terms of excellence, in terms of innovation, and also they have been able to adhere to their core values, and also they have been able to deliver very high quality care and fostering a collaborative culture. So that's what we could say as a successful reputation, an example of this organization we call Mayo Clinic. I had just quoted Cleverland Clinic when we were talking about online platforms, and I did say if you go to their Facebook page, for instance, you will find information that is most recent has been put on their page. So it could be an information that is educative. It could also be information that is going to transform people's lives. Through those platforms, patients can also uh, be able to ask questions and get responses. So that's very important. And then also this Cleverland Clinic, they are healthcare providers. They have also been able to transform and improve their reputation. And they are doing this through patient-centered strategies, improved clinical outcomes, enhanced its operations efficiency, and of course they are very good in terms of communicating their achievements and challenges transparently and authentically. We have very many times emphasized on the need for transparency when we are communicating. Any update that we are giving, we need to be transparent. Mm. We need to be transparent. Let everyone know this is what happened. If it is something negative, we own up to the mistake, and we are going to make any corrective issues going forward. So having got to that point, that would be the final discussion of our class today. Maybe this particular session, anyone who has a comment or a question? So being